Hello? Am I audible?
Yes, sir. Sir, सुन नहीं रहा था.
Thank you. Start गरिदिन्छ class?
हुन्छ sir.
Yes, sir.
Can you see the slide?
Yes, sir.
Yes, sir.
Okay, so often so we studied about anemia. So most common anemia in our part of world is iron deficiency anemia, right? So अरु चाहिँ हाम्रो pediatric age group ma most common cause of anemia other than iron deficiency is hemolytic anemia. So we should be knowing about hemolytic anemia. Hemolytic anemia मा चाहिँ hemoglobinopathies हरु पनि हुन्छ हैन, enzyme deficiency हरु पनि हुन्छ, immune mediated hemolytic anemia पनि हुन्छ. So we'll be discussing them in brief. So am I audible?
Yes, sir.
Yes.
Okay. So first we should know the age of the patient. So since birth the patient is anemic or infancy or childhood or adolescence, right? Since birth ma चाहिँ usually तिम्रो के रे अल्फा थ्यालेसेमियाहरु जस्तो अब हाइड्रोप्स फिटालिस भनेर फिटल डेथहरु हुन्छ है, यो चाहिँ अल्फा थ्यालेसेमियामा चाहिँ फिटल डेथ, रिकरेन्ट फिटल डेथहरु हुन सक्छ हैन. अर्को चाहिँ अब तिम्रो इन्फेन्सीमा चाहिँ युजुअली 6 months to 2 years मा चाहिँ तिम्रो थ्यालेसेमिया, बीटा थ्यालेसेमियाहरु चाहिँ युजुअली प्रेजेन्ट हुन्छ है. Childhood ma G6PD deficiency, and even adolescence ma, if the patient is taking any oxidative stress or drugs that causes increased demand of G6PD enzyme, then it might lead to hemolysis है अर्को चाहिँ मेल X linked हुन्छ जस्तो G6PD deficiencyहरुमा चाहिँ X linked हुन्छ paleness or yellow discoloration of body you should be looking about it हैन अनि weakness fatigue irritability poor feeding there might be fever in case of sickle cell anemia मा चाहिँ तिम्रो sickle cell crisis भयो भने चाहिँ त्यसले गर्दाखेरि fever acute chest syndrome dactylitis हरु हुन सक्छ that might causes fever dyspnea in case of sickle cell anemia हैन त्यो acute chest syndrome भएर आउन सक्छ pain abdomen hematuria blood mixed stools history of fracture or osteomyelitis in case of sickle cell anemia ethnicity मा चाहिँ Asian African Americans हैन कतिको चाहिँ यो मलेरियासँग के रे बाँच्नलाई चाहिँ there might be sickling हैन त्यो चाहिँ तिम्रो नेचरले नै त्यस्तो उनीहरुको ब्लड सेलहरु चाहिँ सिकल गर्दै हुन्छ सो है अर्को चाहिँ पास्ट हिस्ट्रीमा चाहिँ हिस्ट्री अफ प्रायर हस्पिटल एडमिसन or not history of previous blood transfusion थियो कि थिएन history of surgical procedures such as endovascular devices aortic stenosis or ECMO हैन यिनीहरुले प्रोस्थेसिस valve ले चाहिँ तिम्रो extrinsic hemolysis गर्दिन्छ है किनभने तिम्रो valve चाहिँ त्यो प्रोस्थेसिस भएकोले चाहिँ it might cause hemolysis of the RPC त्यसलाई चाहिँ cystocytes or helmet cells पनि भन्छ ओके अर्को चाहिँ birth history मा चाहिँ history of previous stillbirth abortion हैन जस्तो in case of hydrospitalis हैन तिम्रो कुनै पनि अल्फा चेन हुँदैन है त्यसमा चाहिँ history of previous stillbirth or abortions हेर्नु पर्यो birth asphyxia trauma transfusion phototherapy in case of RH incompatibility हरुमा हुन्छ family history मा चाहिँ similar illness in the family members consanguinity death of sibling history of cholecystectomy splenectomy हरु हुन सक्छ drug intake history लिनु पर्यो like beta lactamase ceftriaxone intravenous immunoglobulin methyl dopa non NSAIDs penicillin piperacillin dapsone nitrofuran ibuprofen interferon mefloquine metronidazole ले चाहिँ G6PD deficiency गराउन सक्छ whereas in case of तिम्रो methyl dopa ले चाहिँ autoimmune hemolytic anemia हरु गराउन सक्छ अर्को चाहिँ you should be knowing the infectious cause of hemolysis also हैन तिम्रो मलेरिया ले पनि तिम्रो hemolysis गराउँछ so you should know the travel history हैन there might be fever as well as history of hemolysis अर्को चाहिँ on examination general condition of the patient हेर्नु पर्यो is it active or sick looking हैन hemolytic disease अनि usually active हुन्छ so thalassemia हरु चाहिँ खासै यो chronic anemia ले गर्दाखेरि even though the hemoglobin is 4 or 5 they are well to do अनि paler icterus छ कि छैन usually they are very pale severely pale हुन्छ icterus icteric पनि हुन्छ lymphadenopathy edema छ कि छैन mongoloid face है short stature skull bossing prominent forehead as you can see on the picture maxilla flat nasal breeze separated teeth leukonychia coelonychia ankle ulcer petechial rashes so most of the hemolytic disease they are below less than third centile so you should look for heart rate respiratory rate temperature blood pressure systemic examination per abdominal exam there might be hepatosplenomegaly अनि CVS मा फ्लो मर्मर्स हरु हुन सक्छ पेरिकार्डियल रब हरु हुन सक्छ रिथमियाज हरु हुन सक्छ हैन एक्सट्रीमा चाहिँ एडेड साउन्ड एयर एन्ट्री डिक्रिज एयर एन्ट्री हरु हुन सक्छ CNS मा डेलिरियम टोन पावर रिफ्लेक्स चाहिँ increase or decrease हुन सक्छ in case of sickle cell anemia due to तिम्रो vaso-occlusive crisis भयो भने चाहिँ So coming to lab examinations, complete blood count पठाउनु पर्यो peripheral blood smear there might be microcytic, normocytic, helmet cells हरु हुन सक्छ spherocytes हुन सक्छ cystocytes हरु हुन सक्छ acanthocytes हरु हुन सक्छ reticulocytes हरु हुन सक्छ in case of sickle cell disease sickle cells हरु हुन सक्छ target cells चाहिँ hemoglobinopathy such as in case of hemoglobin C sickle cell thalassemia liver disease हरु हुन सक्छ cystocytes Burr cells helmet cells RBC fragments are seen in microangiopathic hemolytic anemia that is seen in DICA, HUS, TTP, or in venoms. Spherocytes can be seen in hereditary spherocytosis or autoimmune hemolytic anemia. Cigar-shaped cells can be seen in case of hereditary elliptocytosis. Bite cells can be seen in G6PD deficiency. Poikilocytosis, microfragmented erythrocyte elliptocytes can be seen in hereditary pyropoikilocytosis. And basophilic steepling can be seen in lead poisoning. So you can see the sickling of the cell. You can see over here. यसमा चाहिँ you can see the target cell है तिम्रो center halo pale हुनुपर्ने यसमा चाहिँ target sign जस्तो देखिन्छ अब यसमा चाहिँ Heinz spot these are denatured hemoglobin is seen in case of G6PD deficiency यो चाहिँ cystocytes यो helmet जस्तो देखेछ नि these are cystocytes अनि यो पनि सिक्लिङ हो हेर यहाँ कति सिकल सेल्सहरु छ दिस इज सिकल है सिकल भनेको चाहिँ हसिया जस्तो हुन्छ जो यो चाहिँ सिक्लिङ अर्को चाहिँ यो चाहिँ बाइट सेल्सहरु है ओके यो बाइट सेल्स चाहिँ G6PD मा देखिन्छ है त सो अर्को चाहिँ MCV MCH reticular cyte count sodium potassium urea creatinine urine analysis stool culture left they haptoglobulin usually decreased in case of hemolytic disease अनि LDH are increased and तिम्रो hemolysis हुन्छ त्यही भएर LDH increase हुन्छ osmotic fragility test is seen in case of hereditary spherocytosis hemoglobin electrophoresis is done in case of sickle cell anemia as well as in case of thalassemia direct Coombs test can be done in case of autoimmune hemolytic anemia or in case of RS incompatibility or ABO incompatibility iron profile can be done ferritin transferrin level and TIBC iron deficiency anemia ma ke huncha can anyone say iron profile ke huna sakcha in case of iron deficiency anemia ferritin ke huncha transferrin level ke huncha TIBC ke huncha am I audible
for ferritin
Yes, sir.
level storage level घट्ने भयो ferritin level and
only thing that is increased is total iron binding capacity
TIBC level चाहिँ free protein को level बढेको हुनाले TIBC पनि बढ्छ अनि त्यहाँबाट चाहिँ transferrin पनि बढ्छ
so everything is decreased except TIBC in case of iron deficiency anemia but in case of thalassemia तिम्रो ferritin level increase हुन सक्छ serum iron increase or normal हुन सक्छ transferrin level पनि increase or normal हुन सक्छ हैन TIBC normal हुन सक्छ so you should be aware of whereas in case of iron deficiency anemia TIBC is increased where all of the parameters is decreased मैले बोलेको राम्रै सुनेछ कि छैन
राम्ररी सुनेको छु सर
Yes, sir. Yes, sir.
break भएर आइराछ
Fine, sir. Fine, sir.
so अर्को टेस्ट भनेको eosin 5 maleimide flow cytometry this is done in case of hereditary spherocytosis अर्को bone marrow can be done x-ray skull x-ray hand x-ray chest can be done USG cranium and MRI है यो चाहिँ तिम्रो hair on in appearance भन्छ है is seen in case of thalassemia है due to extra medullary erythropoiesis है तिम्रो बोन म्यारो चाहिँ एक्सपान्ड हुन्छ हैन त्यो चाहिँ हेयर अन इन अपीयरेन्स आउँछ त्यसले गर्दाखेरि सो दिस इज द केस अफ डैक्टालाइटिस है यहाँ तिमीले लाइटिक लिजनहरु देखिराछ है फार्लिन्जेसहरुमा है कार्पल बोन्सहरुमा चाहिँ यु क्यान सी दैट देयर आर लाइटिक लिजन है यो चाहिँ तिम्रो दिस इज सीन इन केस अफ कसलाई थाहा छ ल भन त डैक्टालाइटिस कुन कन्डिसनमा हुन्छ hand foot syndrome पनि भन्छ नि हैन in case of sickle cell anemia so hemoglobin is a tetramer consists of two pairs of globin chains हैन 4 unit हुन्छ so 2 alpha chain हुन्छ 2 beta chain हुन्छ है त each chain is associated with prosthetic group the heme alpha and beta globin genes are encoded on chromosome 16 that is alpha and 11 beta respectively these proteins are referred to as hemoglobinopathies. These results from the following synthesis of abnormal hemoglobin, reduced rate of synthesis of normal alpha or beta hemoglobin chains leading to alpha or beta thalassemias. So classification of hemoglobin disorders, quantitative disorder of hemoglobin chain synthesis or accumulation, that is beta and alpha thalassemia. Qualitative disorders, one is sickle cell anemia, hemoglobin with decreased stability and mutants causing congenital Heinz body, hemolytic anemia, acquired instability, oxidant hemolysis, drug-induced or G6PD deficiency, hemoglobin with altered oxygen affinity, methemoglobinemia, or post translation modification. Here's a classification of hemoglobin disorders. So now we'll be talking about sickle cell anemia. Here's a qualitative hemoglobin so disease. So mutation on beta globin coding gene that is in chromosome 11. This is important, right? Beta globin is chromosome 11, but alpha is 16 chromosome. So substitution of glutamic acid for valine. So you can see over here, hey, your chromosome this is the 11th chromosome, and यसमा चाहिँ तिम्रो glutamate है त्यो green मा चाहिँ the glutamate is replaced by the valine. Sorry, substitution of glutamic acid for valine. So valine is replaced है. अर्को चाहिँ adenine चाहिँ uracil हुन पर्ने ठाउँमा चाहिँ adenine हुन्छ है. यो चाहिँ सिक्लिङ गराइदिन्छ है त त्यसले गर्दाखेरि. So sickle cell anemia भनेको चाहिँ usually homozygous हुन्छ है. So more than 90% of the hemoglobin is sickle, or more than 50% occurs when both beta hemoglobin alleles have the sickle cell mutation. Both beta coding gene चाहिँ तिम्रो absent भयो भने चाहिँ that is sickle cell anemia. So refers a sickle cell disease भने चाहिँ sickle refers to only patient with sickle cell anemia, but also has compound heterozygotes where one beta globin allele includes the sickle cell mutation and the second allele includes a genetic mutation other than sickle cell mutations such as hemoglobin C, beta thalassemia, hemoglobin D, hemoglobin Arab, and यिनीहरु हुन सक्छ. यो चाहिँ sickle cell disease. In sickle cell anemia तिम्रो जुन चाहिँ homozygous छ भने चाहिँ तिम्रो sickle hemoglobin चाहिँ it can be high as 90% of the total hemoglobin, whereas in case of sickle cell disease मा छ भने more than 50% मात्रै sickling हुन्छ in case of sickle cell disease. So there is a conformational change in case of hemoglobin tetramer. In the deoxygenated state, sickle cell molecules interact with each other, forming rigid polymers that give the red blood cell its characteristic sickle shape. And there leads to intravascular sickling, occurs in the post-capillary venules, causes decrease of the mechanical strength and elasticity of the red cells, and causes hemolytic anemia. And there might be painful vaso-occlusive crisis, and which can damage to organs. The precipitators are stress, hypoxia, cold, dehydration, and infection. Sorry. So a point mutation codon 6 भने हैन त्यसमा चाहिँ तिम्रो valine यसमा हुन्छ त्यसले गर्दा sickling गरिदिन्छ है. अनि in case of deoxygenation तिम्रो RBC sickling हुन्छ that leads to hemolysis है and leading to vaso-occlusion. So oxygen plus and this normal shaped RBC, whereas in case of when there is hypoxia leads to sickling. So clinical manifestations are fever, bacteremia, or plastic crisis, splenic sequestration, hepatic and gallbladder involvement, sickle cell pain in case of dactylitis and vaso-occlusive pain, vascular necrosis, priapism, neurological complication, pulmonary complication, renal disease and enuresis, and cognitive and psychological complication. So vaso-occlusive crisis is caused by sickle-shaped red blood cells that obstruct capillaries and restrict blood flow to an organ, resulting in ischemia, pain, necrosis, and often organ damage. Example, spleen. Hand and foot syndrome or dactylitis. Feet and hand becomes hot and swollen, and movement are painful. So this may be first manifestation of disease in young children with or without fever, right? Your infancy or 2 to 3 years dactylitis present. So you can see the X-ray is normal, whereas in the second X-ray there is inflammation of the soft tissue. So hand is more increased in size and soft tissue inflammation, and light lesions you can see on the bones. And this is the pictorial diagram showing normal RBC, whereas abnormal sickle cell RBC, it causes blocking of the blood flow, leading to vaso-occlusion. So acute chest syndrome, since you can see over the X-ray, and you can see the effusion. There might be fever, discomfort, or difficulty in breathing, dyspnea, rapid breathing, and cough and chest pain. Use acute symptoms and bacterial infection. So you have to give antibiotics because the spleen तिम्रो एब्सेन्ट भयो भने चाहिँ that might lead to pneumococcal, meningococcal हैन hemophilus influenza चाहिँ डिजिजहरु हुन सक्छ अर्को चाहिँ splenic sequestration is an acute painful enlargement of the spleen caused by intrasplenic trapping of red cells resulting in a precipitous fall in hemoglobin levels with the potential for hypovolemic shock. So sequestration crises are considered an emergency if not treated. Patient may die within 1 to 2 hours due to circulatory failure. These crises are transient. They continue for 3 to 4 hours and may last for 1 day. Our neurological complications are varied and complex. Acute ischemic stroke with focal neurological deficit can be there. So clinical silent abnormalities found on radiologic imaging. So overt stroke, focal neurological deficit lasting for more than 24 hours or abnormal neural imaging of the brain indicating a cerebral infarct on TT weighted MRI corresponding to the focal neurological deficit. You can see the left part of the brain, there is ischemia. So silent cerebral infarct lacks focal neurological finding lasting for more than 24 hours and is diagnosed by TT weighted MRI. So sickle cell disease, they are really increased susceptibility to infection. Children sometimes as young as 3 months and to lesser adults are very susceptible to bacterial infection that can be fulminant and therefore must be treated promptly. Increased susceptibility to infection is due to splenic dysfunction. There might be pneumonia, hepatitis, meningitis, UTI, septicemia, and bone and joint infection. So you say ischemia. Now coming to lab findings, the hemoglobin is usually very low, high retics alone. Sickle cell and target cell can occur in the blood. Features of splenic atrophy, that is how whole bodies or may be seen. So you can see the sickle cell anemia, target cells, or you can see in the peripheral blood smear. Screening tests for sickling are positive when the blood is deoxygenated with dithionate and sodium HPO4. Or high performance liquid chromatography or hemoglobin electrophoresis पनि भन्छ है HPLC भने high performance liquid chromatography पनि गरिन्छ in sickle cell anemia and there is no detection of adult hemoglobin. The amount of fetal hemoglobin is varied and is usually 5 to 15%. Larger amounts are associated with milder disorders. So fetal hemoglobin चाहिँ जति धेरै भयो त्यति नै disease process चाहिँ milder हुन्छ. So you can see in this hemoglobin electrophoresis sickle cell anemia, sickle cell hemoglobin is more. So management of the disease is hydroxyurea. Hydroxyurea ले चाहिँ fetal hemoglobin चाहिँ increase गराइदिन्छ है. And so the patient is sickle cell crisis बाट चाहिँ they are free from sickle cell crisis. अर्को चाहिँ red blood cell transfusion can be given. So in case of sickle cell crisis, we have to give prophylactic penicillin, spleen. If there is, we have to look for spleen palpation. In case of immunization, we have to give. There is also autosplenectomy by sakyo. So autosplenectomy usually 0 to 4 years by success. So we have to give immunization for the capsulated organisms such as pneumococcal, meningococcal, hemophilus influenza. Transcranial Doppler ultrasound hydroxyurea, regular blood transfusion therapy might be done, pulmonary and asthma screening, retinopathy, renal function, and echocardiography should be done. So this is a diagram showing sickle cell disease complication by age. So infant to toddler, they might be functional asplenia. Splenic autoinfarction can be seen in case of 4 to 20 years. Bacterial infections from infancy to 20 years. Dactylitis can be seen in case of 1 to 4 years. Autosplenic sequestration can be seen in case of 1 to 20 years. Pain, ischemic stroke, hypostenuria, silent stroke, priapism, gallstone, hemorrhagic stroke, vascular necrosis, retinopathy can be seen. So you should be knowing about this by age, right? The complication. Whereas in sickle cell trait, only sickle cell hemoglobin is less than 50%. Sickle cell trait, and the sickle cell disease more than 50%. So the CBC is within the normal range. Hemoglobin analysis predominantly adult hemoglobin, typically more than 50%. अर्को चाहिँ hemoglobin C भन्ने हुन्छ. The mutation for hemoglobin C is the same site as hemoglobin S, with the substitution of lysine instead of valine for glutamine. So hemoglobin C is asymptomatic, while homozygous it might be milder form. There might be mild anemia, splenomegaly, and cholelithiasis. Sickling doesn't occur, diagnosed through newborn screening programs, and hemoglobin C crystallizes, disrupting the RBC membrane, and hemoglobin C crystals may be visible on the peripheral blood smear. Or second most common cause after the thalassemia, hemoglobin E is an abnormal hemoglobin resulting from quantitative mutation in beta globin gene and is the second most common globin mutation worldwide. Patient may have asymptomatic hemoglobin E or benign homozygous hemoglobin E. Compound heterozygous hemoglobin E or beta thalassemia produces clinical phenotypes ranging from moderate to severe anemia depending on the thalassemia mutation. Or hemoglobin D, at least 16 variants of hemoglobin D exist. So hemoglobin D Punjab or Los Angeles is a rare hemoglobin that is seen in case of 1 to 3% of Western Indians and in some Europeans and Asian Indian ancestry, and produces symptoms of sickle cell disease when present with combination of sickle cell hemoglobin. Or heterozygous hemoglobin D or which is clinically silent, homozygous produces milder disease. Now coming to quantitative hemoglobinopathies, यो चाहिँ thalassemia syndromes हरु. So thalassemia syndromes मा चाहिँ genetic disorders of globin chain production in which there is imbalance between alpha globin र beta globin chain हुन्छ. So clinically, three main syndromes are present. एउटा transfusion dependent thalassemia major भयो, यसमा चाहिँ beta globin gene हुँदैन. अर्को चाहिँ non transfusion dependent thalassemia intermedia with a moderate degree of anemia due to variety of genetic defects. Right? यसमा चाहिँ तिम्रो decrease or reduced function of beta globin gene है. Whereas in case of thalassemia major, यसमा चाहिँ absent beta gene function हुन्छ. है. अर्को चाहिँ thalassemia minor, in which there is reduced, है, reduced पनि हुन सक्छ. So usually due to यो चाहिँ carrier state of thalassemia minor for alpha or beta thalassemia. You can see on the graph, right? So hydrophytalis चाहिँ तिम्रो कुनै alpha hemoglobin भएन भने hydrophytalis भयो. एउटा मात्र alpha gene छ भने चाहिँ hemoglobin H भयो. Trait मा चाहिँ है alpha 2 beta 2 हुन्छ. Normal चाहिँ alpha 4 र beta 2 हुन्छ है normal मा चाहिँ. है trait मा चाहिँ alpha 2 beta 2 or alpha 3 beta 2 हुन सक्छ है. So normal चाहिँ alpha 4 beta 2 हुन्छ. Beta thalassemia trait छ भने alpha 4 beta 2 हुन्छ है. अर्को चाहिँ alpha 4 with reduced function है. So यो beta plus भनेको चाहिँ reduced function भयो. Whereas beta 0 भनेको चाहिँ absent function है. So यो चाहिँ तिम्रो thalassemia major मा चाहिँ absent function भयो. Thalassemia minor intermedia मा चाहिँ तिम्रो decreased function or reduced function भयो. Now coming to thalassemia homozygous beta thalassemia or thalassemia major, Cooley's anemia पनि भन्छ यसलाई. So whether the production of beta globin chain is absent or reduced, हैन, त्यो अनुसार चाहिँ beta thalassemia major भयो, in which there is a beta chain चाहिँ absent हुन्छ. Reduced चाहिँ in case of intermedia हुन्छ. Minor मा चाहिँ अलिकति मात्र reduce हुन्छ, or there is just a trait है. Average in 1 in 4 offspring if both parents are carrier of the beta thalassemia trait. Excess alpha chain precipitates into erythroblast and in mature red cell, causing severe ineffective erythropoiesis and hemolysis. The greater the alpha chain excess, the more severe the anemia is. The majority of genetic lesions are point mutation rather than the gene deletion. This mutation may be within the gene complex itself or in promoter or enhancer region. To compensate a massive hemolysis, erythropoiesis is increased in the bone, leading to bony deformities. So in children, facial bones are thickened. So deformation of jaws, flattening of the nose, excessive spacing of the eyes is seen. A secondary complication are due to iron overload consecutive to hemolysis or continuous transfusion. So there might be due to iron overload, it might be iron deficit or that's why serum ferritin and serum iron level is increased in case of thalassemia, whereas it's in case decrease in case of iron deficiency anemia. Right? So endocrine and metabolic disorders due to iron deposition, hypogonadism, stunting, diabetic, hypothyroidism, cardiac leads to hemosiderosis or arrhythmia. So lab diagnosis must severe hypochromic microcytic anemia with normal blasts or target cells and basophilic stippling in blood film can be seen. High performance liquid chromatography, usually used as a first line method to diagnose hemoglobin disorders, reveals absence or almost complete absence of hemoglobin A, that is adult hemoglobin, with almost all circulating hemoglobin being the fetal. Hemoglobin 2, A2 percentage is normal or low or raised. So also DNA analysis is used to identify the defect on each allele important in antenatal diagnosis. And biochemistry hemolysis, there is increased lactate dehydrogenase, well as decreased haptoglobulin, is increased iron overload and ferritin. So the treatment is transfusion therapy, chelation therapy with D-ferridox, iron overload monitoring, hydroxyurea, hematopoietic stem cells transplant, splenectomy, right? Or other beta thalassemia syndromes are beta thalassemia intermedia. So in the beta thalassemia intermedia, the transcription of both beta genes are altered, but they are still allow the production of hemoglobin in reduced amounts. The symptoms are less severe than in case of Cooley's anemia. Microcytic hypochromic anemia occurring late in life in 1 to 2 years, and less pronounced anemia is there. So jaundice, splenomegaly might be there, bone deformities might be there or might not be there. There might not be stunting. Whereas in case of beta thalassemia minor, the minor beta thalassemia is caused by mutation of one of the two beta genes. Usually this form has no impact on health since the other gene is able to compensate the anomaly and make enough beta genes to produce normal or near normal levels of hemoglobin, and there might be microcytosis. So beta thalassemia usually it doesn't present at birth. Can anyone say why it doesn't present at birth? Beta thalassemia
Fetal hemoglobin.
SVF.
So alpha र gamma chain मात्र हुने भएर
त्यही त अब फिट ड्युरिङ बर्थ कति हुन्छ तिम्रो अडल्ट हेमोग्लोबिन र फिटल हेमोग्लोबिनको प्रोपोर्सन कति हुन्छ मैले अस्ति नै भने हैन कति हुन्छ अरे सो अडल्ट हेमोग्लोबिन 30 छ भने तिम्रो फिटल हेमोग्लोबिन तिम्रो 70 जति हुन्छ है अनि A2 चाहिँ युजुअली तिम्रो 1 to 3.4% माथि हुन्छ अडल्ट हेमोग्लोबिन चाहिँ तिम्रो 30 जति हुन्छ हैन फिटल हेमोग्लोबिन चाहिँ तिम्रो 70% जति हुन्छ ड्युरिङ बर्थ बट एज एज तिम्रो मच्योर हुँदै जाँदाखेरि चाहिँ 2 to 6 months मा चाहिँ तिम्रो अडल्ट हेमोग्लोबिनमा भइसक्छ सो अडल्ट हेमोग्लोबिन चाहिँ तिम्रो मोर हुन्छ है तिम्रो चाहिँ धेरै भएर आउँछ सो इन केस अफ बिटा थ्यालेसेमियामा चाहिँ तिम्रो अडल्ट हेमोग्लोबिन तिम्रो के अरे फिटल हेमोग्लोबिन हुन्छ त्यही भएर बिटा चेन्ज चाहिँ हुँदैन हैन तर जब अडल्ट हेमोग्लोबिनमा बन्न जान्छ त्यो बिटा चेन्ज चाहिँ भएर चाहिँ त्यो बिटा म्युटेसन हुन्छ सो युजुअली प्रेजेन्टेसन चाहिँ 6 months to 1 year हुन्छ है त बुझेछ
Yes, sir.
Yes, sir.
सो अर्को चाहिँ अल्फा थ्यालेसेमिया सिन्ड्रोम्स हुन्छ है सो नर्मलमा चाहिँ यो चारवटा जिन भयो यहाँ तिम्रो राइट साइडमा देख्न सक्छौ थ्यालेसेमिया ट्रेटमा चाहिँ एउटा जिन एब्सेन्ट हुन्छ माइनरमा चाहिँ दुईटा जिन एब्सेन्ट हुन्छ मेजरमा चाहिँ हेमोग्लोबिन एच पनि भन्छ तीनटा जिन एब्सेन्ट हुन्छ हाइड्रोफिटालिसमा चाहिँ चारवटै जिन एब्सेन्ट हुन्छ है so you can see here so thalassemia syndromes मा चाहिँ alpha gene deletion or less frequently mutation हुन्छ the clinical severity related to the number of 4 alpha genes missing or inactive loss of all 4 genes completely suffers alpha cell chain synthesis so alpha chain is essential in fetal as well as in case of adult hemoglobin this is incompatible with life and leads to death in utero So 3 gene deletion leads to moderately a severe microcytic hypochromic anemia with splenomegaly. So hemoglobin H disease because hemoglobin H can be detected in red cells of this patient by electrophoresis. In fetal life, say, parts hemoglobin पनि भन्छ. So तिम्रो number of allele affect गरेको हिसाबले चाहिँ यो clinical features गरेको है. So clinical manifestation, if one allele is affected, there is silent form. 2 alleles on a few symptoms, microcytic hypochromic anemia on सक्छ. Hemoglobin H there might be microcytic hypochromic anemia with hepatosplenomegaly in 4 fetal are very severe. The fetus cannot live outside the uterus and may not survive gestation. Some most such infants are still born with hydrops fetalis, and those who born alive die shortly after birth. Now coming to glucose 6-phosphate dehydrogenase deficiency. The G6PD deficiency is a critical for RBC defense against oxidative injury due to its role in replacement of nicotinamide dinucleotide phosphate hydrogenase via the pentose pathway. So worldwide, G6PD deficiency has a prevalence of 400 million cases. It is X-linked. So WHO classification are class 1 variants lowest enzyme activity and cause the most severe disease, resulting in chronic extravascular hemolysis. Or goes class 2 variants severe deficiency and intermediate hemolysis. Class 3 demonstrate moderate deficiency and intermediate hemolysis. So you can see here glucose hexokinase G6 glucose 6 phosphate one. So NADPH glutathione reductase NADP plus गरिदिन्छ है. So अनि यसमा चाहिँ तिम्रो G6PD, so glucose 6 phosphate dehydrogenase हुन्छ, that gives to the end product of 6 phosphogluconate. So your G6PD absent भयो चाहिँ the RBC cannot handle the oxidative injury. So usually after ingestion of oxidative stressors such as illness and fever, dehydration, or flava bean ingestion. Do you know what is flava beans?
छोटो broad beans.
Rajma.
बकुला हो, बकुलाहरु त्यस्तो तिमीहरूले सोध्नु पर्यो यो बकुलाहरु खान्छ कि छैन भनेर चाहिँ हिस्ट्रीमा सोध्नु पर्छ है. एकैचोटी कसरी प्रेजेन्ट गर्छ, एकैचोटी पेशेन्ट नर्मल हुन्छ हिजो, तर मदरले चाहिँ एकैचोटी उले चाहिँ पेल भएको देखिन्छ हैन. So that might be after ingestion of flava beans, or can be due to medication such as sulfonamides त्यो चाहिँ तिम्रो cortimoxazole हुन सक्छ, or anti-malarials है, dapsone है, few antibiotics हैन, that might lead to G6PD deficiency. So investigation मा चाहिँ hemoglobin मा there might be anemia, reticulocytosis, high unconjugated bilirubin, lactate dehydrogenase, and decreased haptoglobin due to hemolysis हुन्छ. अनि हामीले चाहिँ G6PD enzyme चाहिँ हामीले पठाउन मिल्छ हैन, एक्टिभिटी के छ हैन, डिक्रिज छ कि छैन, and we can ensure and counsel the patient to avoid oxidative triggers हैन. So तिम्रो ड्रग्सहरु चाहिँ हामीले लिस्टहरु चाहिँ दिन सक्छौं है, यस्तो पेशेन्टहरुलाई चाहिँ यो ड्रगहरु नखानु, यो कुराहरु नखानु भनेर चाहिँ एउटा के रे लिस्ट चाहिँ दिएर पेशेन्टलाई डिस्चार्ज गर्न मिल्छ. So in case of hemolytic episodes, they are self-limited but sometimes require transfusion. In case of severe anemia, those patients require transfusion. अर्को चाहिँ pyruvate kinase deficiency is a congenital hemolytic anemia. It's autosomal recessive. There is marked reduction in red blood cell pyruvate kinase on production of abnormal enzyme with decreased activity, resulting in impaired conversion of phosphoenol pyruvate to pyruvate. And generation of ATP within RBC at this step is impaired. So our ATP production is impaired, and low levels of ATP, pyruvate, and the oxidized from NAD plus are found. So RBC cannot maintain their potassium and water content. The cells become rigid and lifespan is reduced and causes hemolysis. Right? As my neonate they can present with jaundice, anemia, kernicterus. Hemoglobin 8 to 12 gram per deciliter associated with some pallor, jaundice, splenomegaly, reticulocyte can be extremely elevated. Polychromophilia or mild macrocytosis treatment